My name's Ed Crane, and I'm with a private practice group called Oncology Hematology Care. We have, I believe, 20 offices in the greater Cincinnati area. I have been asked to talk about the advances in treatment of breast cancer, which actually could probably be a week-long talk, but I'll consolidate it into about 15 minutes. I'd like to start by just mentioning that it's important to remember that 1% of all breast cancers do occur in men. It's not common, but it does happen. What, unfortunately, I see in my practice is many men get diagnosed at a later stage because they didn't realize that men could get breast cancer. So detection, a mammogram starting at age 40 or 10 years earlier than the age of onset of a first-degree relative with breast cancer. A breast MRI is a highly sensitive tool, but it also has a high false positive rate. We also have something called CT PET, which really isn't for detection of actual breast cancer, but it helps to evaluate if the disease has spread elsewhere. And what this involves is a regular CAT scan, but then patients also receive a radio-labeled sugar that goes to areas of increased activity in the body and can help us decide if the cancer has spread elsewhere in the body. Tailoring therapy. It can be difficult to determine who would benefit from chemotherapy to improve cure rate after surgery. So there's actually a relatively new test called Oncotype DX, and this is a 21-gene analysis of the patient's own tumor to determine what is the risk of this cancer coming back, basically, or recurrence. And then you can decide personally, is that a reasonable amount of improvement to warrant undergoing the side effects of chemotherapy? There are some new radiation techniques. There's accelerated partial breast irradiation. So instead of treating the whole breast with radiation after surgery, which takes 6 weeks, this consists of treating the tumor cavity and a small portion of surrounding tissue with radiation over a 5-day period. Basically, what is done is at the time of surgery, they place a balloon catheter into the cavity where the breast cancer was, and then you have a tube that's coming out of the breast where the radiation fluid and seeds can be infused into that balloon. This is just an example of what it looks like. You've got the balloon in the tumor space and then the catheter coming out. So there is a medication called Aloxi, which is a stronger anti-nausea medicine, lasts longer, up to 40 hours. It's given prior to IV chemotherapy. Education is improving as well. We are improving access to clinical trials, having more places in the community where you can actually go to participate in a clinical trial. I think that there's been a better emphasis regarding the understanding of the psychosocial aspects of cancer diagnosis and treatment. There's a better focus on palliative care now than there ever was. And then also, it's important to have advocacy, not just for the issues that I mentioned, but to help promote research in cancer so that we can continue to push the boundaries and improve our overall care.